So I am thrilled tonight to have Dr. Adelia Sapp with me. She's a naturopath in Seattle. And Dr. Sapp, please welcome and tell our audience a little bit about yourself.
Hi, Dr. Tracy. I'm also thrilled to be here today. I'm a primary care doctor in the Seattle area, originally Canadian, connected with a DNA company when they were first starting as a startup in Toronto, making supplements in the back in a warehouse. It was a small operation, and that was when I just graduated. Now I do primary care as a naturopathic doctor. I tend to focus on a lot of fatigue and mental health concerns are two of the biggest areas that I serve. But being in primary care, I see a little bit of everything. So this is kind of a general webinar we have today. The topic's pretty broad, so I'm really curious what people's biggest concerns or questions are going to be if we have a lot of those. But yeah, starting with the foundations of health and how they relate to our genetics, I think is a great place to start. I see a lot of people in their 30s and 40s, so I think we can both speak to that. Areas for optimization, or even areas to look into when your regular doctor you feel is kind of underserving your needs. So we're not giving medical recommendations today, but we'll help guide you, hopefully, in the right direction for where to look to figure things out. So yeah, happy to be here.
Excellent. So this is designed to be a Q&A primarily. We do have a lot of things. I mean, we can talk about this stuff all day and all night, and that's one of the reasons that we do what we do. But we also really are interested in hearing your questions. So please do put the questions in the Q&A. And Dr. Sapp, would you like to just kind of go over that foundational piece while people are finishing the poll and all of those things, and then we'll get into the poll questions, and then hopefully start taking some questions from the audience live.
Yeah, so in terms of the foundations of health, I mean, a lot of us know kind of what they are more or less, right? So it's things like diet and nutrition. A lot of people don't know what to eat right now because there's a lot of conflicting information out there. So that's why I think that bioindividuality is really helpful, like figuring out how we're all individual, how we personally metabolize fat, how we metabolize starches, whether we need a low sugar, low carbohydrate diet, if we have like suboptimal TCF7L2, for example. So diet being one area, these genetic reports can help clarify kind of where you should be looking personally. And then sleep. So those are some of the genes that we didn't have as many of before in terms of circadian rhythm genes, knowing whether you're more of a morning person genetically, whether you're more of a lark or a night owl, whether you need to work extra hard. You probably already know, but the genes can help guide nonetheless in terms of whether you have like more trouble falling asleep. Um, Another area for foundations is detox. So that didn't used to be part of what I considered a foundation of health. But it turns out, especially with all of our toxic burdens increasing, especially in the US, where there's a lot of toxins that aren't as regulated. Um, but in general, like the global toxic burden is increasing. So I would say that working on your detox or supporting it is extra important nowadays. So I'd consider that a foundation now. And then stress management. So the genes in the executive function profile are pretty important for that. And they can tell us a bit about our sort of response to stress. I know we can both talk about that in terms of our genes. We've both been pretty open in terms of those genes for ourselves, like things like how you break down epinephrine or norepinephrine, what your neuroplasticity looks like in terms of your BDNF production, what you're prone to there. your serotonin metabolism, things like that. Those can all affect your stress response. Um, and then what else do we have? Relationships. I mean, is definitely, we know that social isolation is a huge risk factor in terms of health, even more than pack-a-day smoking, some research suggests. So the relationships can kind of relate to a, a lot of these sections because your health ends up affecting your relationships. I would say stress management would be a big one. And then your immune system um, is at this point, I would say, a foundation of health. And that's like things like how your methylation works, how you bring down inflammation in your body, things like your vitamin D metabolism, because that directly affects your immune system. Um, and I see a lot of people with latent infections, in primary care. And one of the most common ways it manifests is fatigue. So if you have like ongoing, lingering fatigue, there's a good chance that there's some kind of immune activation in the background. And that's become more and more common, since pandemic, but just like over time as well. So taking care of inflammation in your immune system would also be a foundation. I don't know if you had anything to kind of add to that.
I think that hormonal health is also a component of that, and
Yeah,
not just sex hormones, but thyroid hormones, and the entire endocrine system does impact all of that.
totally.
And so that was the one section that I was thinking of
Yeah.
that you didn't hit, but that felt
Hmm.
really related to everything. So yeah,
Super related. And yeah, we're seeing more and more kind of mutations in some of the hormone genes. Like there may be some epigenetic changes, but there's a lot you can do to modify that. So yeah, there's I see a lot of women in the perimenopause phase, and some of them we can work on their hormones through supplements, others go on bioidentical hormones. It all depends. There's a lot you can do with just diet as well. So yeah. Yeah,
absolutely.
and yeah,
So I'm seeing a couple of questions that are in the chat instead of the Q&A, and I think some people are having trouble accessing it. Sometimes if you're on your phone, it's hard to see the Q&A, and so I'm just going to just take a look at some of those. But
yeah,
please try to use the Q&A section if you can, because when things really get cranking over here in the chat with other things happening, we don't always see them. So we have a question about prescribing bioidentical hormones. We do have programs through the DNA company that are specific to DNA for women, DNA for men, and if appropriate, we do prescribe bioidentical hormones. The testing that we would do for that, we would do some sort of either a dried urine test or MIRA, which takes a measurement of your hormones throughout the month. And we would probably also do a blood test. One of the reasons for doing both blood and urine is because if you have a lot in your blood, but not so much coming through in your urine, it's kind of sticking around and maybe it shouldn't. And likewise, if you have low amounts in your blood, but a lot's coming out in your urine, then that's telling us that you're metabolizing it more quickly than someone might expect. And so your dosage would need to be altered based on that. I can't give any specific advice, but that's just how we would handle it. And that's how we would decide whether or not hormones were appropriate for someone. Also, their lifestyle, not everyone wants to be on hormones of any kind. And so then there are other options for that as well that we have access to here at the DNA company. Do you have anything to add to that, Dr. Sapp?
yeah, I mean, that's good to know that that's now an offering at the DNA company. I prescribe bioidenticals, but usually it depends. I start with a blood test, but I also look at a urinary test, ideally, to see if the person is producing more toxic estrogen metabolites. So we have some of the genes for which pathways people go down in terms of what estrogen metabolites they're producing more of. So there's like the good the bad and the ugly they're referred to, the 2-hydroxy, 4-hydroxy, and 16-hydroxy. We're getting a little granular here, but basically we just want to make sure, like, let's say we're looking at estradiol or estrogens, that you're producing more of the healthy estrogen metabolites and not too many of the inflammatory ones, like the 16 or 4. And then things like maca, some companies are a lot more effective than others, or DHEA, if there's also like low androgens like testosterone, those can give people a boost. And then there's some, supplement progesterones that you can apply as a cream. If after a while, like someone's going into menopause, the symptoms those aren't enough, then you can increase to estradiol or progesterone capsules. But we're finding out, so it's always good to check if you have a history of hormone-related cancers when you're starting that. We are finding out that there's a lot of protective effects kind of across the board for those hormones. But again, it's very individual and something to talk to a clinician about, because you don't want to mess around with them and get the wrong prescription. Sometimes people have atypical responses also, so there's no one size fits all solution there. Yeah.
All right, so we do have a question in the Q&A,
Hmm.
which is there are a lot of advertisements for melatonin for better sleep. Um, there might be someone has read something that it might be linked to heart issues, wondering if you have any comments on that.
Yeah, I mean, there's some evidence that melatonin can also be cardioprotective. So it does depend on the individual. If they have a family history of heart failure, they may want to talk to their doctor about that. If they don't have many cardiovascular risk factors, if they have regular cholesterol, regular blood pressure, they're not a smoker, they don't drink, have a good diet, melatonin is usually more of an antioxidant. So it's usually more helpful. So often people will know pretty quickly if it's for them. They'll get like muscle tension or nightmares. Some people get weird side effects like that. But if they're taking a moderate dose, like around 5 milligrams, and they don't get any side effects and it's helping their sleep, I would say that the pros would outweigh any potential risks for the most part, because sleep is definitely a foundation of health, which will help your cardiovascular health long term as well. So yeah, risk reward. Overall, melatonin can be really helpful for some people, but it doesn't work for everyone. So it depends what you're using it for. Um, some people with cancer will have like be prescribed higher doses. And then there's different companies which have different qualities as well. So that's something to consider.
Excellent, thank you. So we have a question, which is, can DNA help explain why some people stay stressed longer than others? Um, the short answer is yes, but we have a
Yeah.
much longer answer for you. Um,
Yeah, so yeah, I feel like both of us can speak to that one, right? With slow COMT, as we've discussed. So COMT is a gene that encodes an enzyme that breaks down your neurotransmitters. So let's say those neurotransmitters are the stress ones, like dopamine, which converts to norepinephrine. Um, if you have a bunch of those stress neurotransmitters in your synapses, it's gonna stick around a little bit longer if you have slow COMT and you break down those neurotransmitters more slowly. So those people do tend to hold on to things a little bit longer. They may be not as quick to let things go. May have more sort of stickiness in thinking, or tendencies towards obsessive thinking, less like moving on, like water off a duck's back kind of thing. So that's just one gene that can affect that. Um, I don't know if you had another one to add.
I guess I just wanted to say that generally speaking, stress initiation, like how it impacts the production of these chemicals, how sensitive the receptors are, and
Mm-hmm.
the feedback mechanism, the shut off, right? It's sort of
Mm-hmm.
like if you want to water your garden, you don't necessarily, is it a trickle or is it is it coming out of the hose in a big flooding way? And is there a way to shut it off? Do you have something at the end where you have to press the handle in order for it to come out, or is it just free flowing out of the hose? And if so, how far away is the shutoff mechanism, right? Like that's a
Mm-hmm.
very imperfect analogy, but it's about binding and how long things have to bind and how many of them are produced in the first place, and all of those things have genetic variability to them. So that
Mm-hmm.
was what I wanted to add to that.
Yeah, absolutely. Yeah. And just as a bit of a segue, we got a note from Nina bringing up a study where there's a higher relative risk of developing heart failure over 5 years in terms of melatonin use. So it is again like relative risk is not necessarily the same thing. And I would be interested in comparing that study to other studies, but because other ones have shown no association. But that's good to keep in mind and a good reason to talk to your doctor about it for sure. So,
Well, and another
yeah,
reason to keep in mind that like studies, they actually can sometimes reflect genetic differences, right?
yeah,
So if a certain percentage of people have something that happens, why? What are the other things that are going on for them that are creating that response in them and not in other people? And
yeah,
that's one of the things I think it's really important to keep in mind with studies that have opposite, in addition to how the study was done, how many people were in it, who funded it, all of those things that we're all trying to be aware of. There is also this picture of there's always no study is ever going to say this 100% works for 100% of the people that were tested. That's just not statistically, I don't think it's possible. Um,
yeah, yeah. And
except
then,
except maybe an N of one, right? Like if you
yeah.
only test one person, then otherwise it's going to be there's going to be some more variability.
Yeah, absolutely. And then studies generally go in the direction of the bias of the researcher. I mean, pretty much without fail, actually. So we do have to look at who the study was conducted by. It was by the American Heart Association. I'm not sure if they have a vested interest in, you know, that result, but it would be interesting to look at comparative studies as well. But there's a
Absolutely.
lot of other supplements you can use to help sleep. So, if melatonin's not for
Absolutely.
you. Hmm.
We actually should go backwards a little bit and go over our poll questions, Dr. Sapp.
Sounds good.
Sometimes Dr. Sapp and I just get so excited to talk to each other and you guys that we forget little things like the poll questions. Okay. So our first question was about age. And so it turns out that most of you are either 35 to 44 or 55 plus, with
Hmm.
a smattering of people in between.
Hmm.
And the thing that brought most people here was curiosity about genetics and then longevity, followed by sleep issues. So
Mm.
those are our top things, and I think that's being reflected in some of the questions that are being asked so far.
Hmm.
Um, we asked people if they could identify their stress pattern, and we have a lot of people who stay stressed longer
Hmm.
or are wired but tired, that I'm so tired, but I just can't sleep feeling.
Yeah.
So maybe we can speak to those things a little bit. A few people shut down and a few recover quickly. So
Hmm.
that's, they're probably psyched about that. I wouldn't know. Okay, so
Yeah.
in terms of sleep type, um, we have a significant, almost a third of the people are waking up during the night, and
Hmm.
25% consider themselves night owls. And so I wonder if your genetic reports say that, if you have them, um, or not. So I'm always curious about that. And what they most hope to get out of the webinar. Most people want practical things they can glean from functional genomics reports in general, and understanding of what functional genomics can do for them personally. So we're here to do that. We're here to answer your questions, and we're happy to do it. So, um,
Right.
yeah.
Yeah.
Um,
So in terms of sleep, um, I think like going over some of those new sleep genes would be great.
yeah.
So I know you were talking about the clock gene, which affects your circadian rhythm, and that one's really good to know about.
Yes.
So that's one of the newer genes that I'm a bit less familiar with. Um, and that one, there's like three variations, right? So you can be heterozygous and be more of a morning person, which you mentioned, Tracy, that you were since we were being open about these things.
Yes, so it's
Mhm.
so the clock gene alone isn't how we come up with whether or not someone's a morning person. Yes, I am a morning person,
Okay.
very much
Hmm.
so.
Okay.
But there are we're using in our revamped reports, we're using more genes to talk about that. So if some of you are here and you have the original DNA 360, clock is in there, and that's one of the ones that we would base the fact that you might have a few struggles with circadian rhythm
Hmm.
in that one. So if you have a perfectly functioning clock gene, then that helps with your circadian rhythm, right? And if you're heterozygous like I am, then you might not do so great with things like jet lag and flipping time zones. I'm doing okay, but it's not
Hmm.
always the easiest thing for you. But when we have other genes in the new report that also speak to this, like the PER genes. Um, also help with circadian rhythm. And they are, if you have, like a homozygous for a certain presentation, like I do, then you do tend to be more of a morning person. And if you're homozygous the other direction, meaning you have two of the same alleles that are not consistent with a tendency toward being a morning person, you may be more of a night owl. And there may be people who are wondering, well, what do I do about that? Because I still have to work at 9 o'clock in the morning. How do I help myself to function a little bit better if I consider myself a night owl? So we can definitely get into that.
Hmm.
And then there's even a gene that is specific to how much things like light affect your circadian rhythm. And that it really affects mine, like we
No.
were talking about before. So those are some of
Right.
the genes that those of you who have your newer reports can be looking at clock and CRY1 and PER2 and PER3, and there are two versions of PER3, and one of them is more about the light than the other one. So
Okay. Right. And when we were working with Dr. Mansour, we used to play this game almost. Would you call it a game? Where we guess each other's genes just amongst us in the office for fun. So since I haven't looked at my sleep genes, if I were to tell you I'm more of a night owl who has trouble falling asleep and trouble regulating circadian rhythms, what would you guess I had in terms of my clock and or per genes?
yeah,
And then
clock,
I
I
can,
would, yeah, oh, go
mhm.
ahead. Sorry, go ahead.
No, you go ahead. Yeah, I'm
Yeah,
curious.
yeah, so with clock, I
Hmm.
might assume that you were either heterozygous or that you uh hold on, I have to pull up my because I there are too many genes for me to memorize all of them, Dr. Sapp. There
Yeah,
there are
that's,
just
I hear you.
yeah, there are just too many of them. But in terms of PER,
Hmm.
um, I might guess that you might have at least one T allele in PER2 and
Hmm.
maybe a G in PER3. But I don't think you're not what you're describing is in PER2 probably you might even have two of those if you really are describing yourself as a
Two
night owl.
suboptimals. Mm-hmm.
Yeah, you
Yeah.
might have that.
Okay.
So that is kind of a fun little game to play,
Yeah,
but a lot of different things go into one gene doesn't determine anyone's destiny,
of
right? So even
course.
if you
Of
did
course.
have that, there could be
Yeah.
a million other things going on that are going to make it so that you fall asleep at 9 p.m. like a baby every night and sleep right through the night. So that's why we look at more than one and why every person is an individual. And
Yeah.
also what we do, our lifestyle, can
Yeah.
really impact that. So what are some tips and tricks for you as a night owl person? How do you who has to work and like be
Mm-hmm.
a doctor during the
Mm-hmm.
day?
Mm-hmm.
What are some tips and tricks for people who might be other night owls out there?
So that's in part why I asked, because I think it's like the perfect example in a way of how lifestyle can modify the genetic expression. So I haven't looked at my sleep genes. That's the only section I don't know for sure. However, I would guess. So I had chronic insomnia my whole life until I was 25. For me, melatonin was a game changer. Some of my patients, it's not. Some people who may have some more cardiovascular risk factors, maybe it's not worth it for them. So something to talk to with your naturopath or doctor or functional health coach for sure. Um, but as of that point, melatonin, meditation, and circadian rhythm, waking up at the same time every day were the three things that completely switched it. So I haven't had chronic insomnia since that time. I also made a few dietary changes where I cut out some things I was actually severely intolerant to, like wheat. So those are just a couple lifestyle things where I completely went from night owl, insomniac, unable to really control it in high school and college, to haven't really had an issue since because of lifestyle. So, some of those factors are really morning light exposure. If you are one of those people that's really prone to irregular sleep cycles, getting one of those SAD lights is really helpful, or just actually getting outside. People in
Depending on where you live.
Seattle, depending on where you live,
Mhm.
but even if it's cloudy, you actually do get light exposure. So keep that in mind. Even if it's rainy and cloudy and you live in Seattle, you get light exposure outside. But if you can't get outside, you shine a really bright light that's like 10,000 lux. On an angle usually. Then they're called SAD, sad lights, or they're also called happy lights. So one or the
I prefer
other.
that.
Yeah, happy lights. Yeah, yeah. And they're becoming more and more accessible. So those are great. For some people, melatonin, for some people, a more involved bedtime routine, like a wind down routine that's like an hour, sometimes even longer. Some people it takes them that long to relax. And then other supplements like inhibitory relaxing supplements like glycine or magnesium or taurine, um, or even herbs like valerian or passion flower for racing thoughts. There's all kinds that you can kind of experiment with that have very low risk profiles associated with them. You just want to make sure you're not getting counterfeit supplements. So that's becoming more and more of an issue. So make sure your sourcing is good. And then women in the 40s and even 30s and 50s, sometimes it is hormone related, often actually. So getting your progesterone tested and your estradiol is important. So some women sleep way better when they're taking a progesterone supplement or a bioidentical. So that's another thing that can be a factor, commonly. But there's a lot you can do to modify the expression of those genes. So. And then, yeah.
I wanted to add that metabolism also affects this, right? So
Mm.
if
Hmm.
someone is more prone to blood sugar spikes because of their genetics or because of their lifestyle,
Right.
if if you're eating ice cream every night before bed and then going to bed a half an hour later, and you may fall asleep okay, or you may not, but some people fall asleep just fine, but then it's that wake up in the middle of the night and then they can't go back to sleep when our blood sugar goes up, it can also bring our cortisol up. And
Yeah.
cortisol is supposed to come up in the morning. So cortisol and melatonin have this opposite relationship where cortisol goes up in the morning and then goes down toward the evening. And at that time, the melatonin is starting to come up. And so if you get that cortisol spike in the middle of the night, you could be awake and then it's also not spiking in the morning, making it really hard to get up out of bed. And then you're like, give me the coffee, buy an
Yeah.
IV, please, right? So those are some things to keep in mind. And there are genetics that will impact that. And so for some people, being really mindful of what they're eating, especially for their last meal and when they're eating it. For
Hmm.
some people, it's they have to stop eating 4 hours before. For some people, it's
Hmm.
two. But kind of playing with that line for yourself, just to see, if I eat a little bit earlier and there's more time between my last meal and bedtime, do I sleep through the night better? That's another thing because if you think about it, and also timing of vitamin D, um, certain things like signal our body that it's time to be awake. Like when we're eating, it's like, oh, okay, I have energy and now I can go about my day and do things. If you're
Hmm.
eating right before bed, for some people, they can be really sensitive to having that energizing quality of food. But for other people, if they don't eat enough before bed, then
Yeah.
or close enough to bed, then they also wake up. And this is where individual experiences are really important. And vitamin D is an important regulator also. And it's like it's the sunshine vitamin, right? So even though
Hmm.
some people genetically can't convert it from the sun, from D2 into D3, or have a harder time doing it, and or it's not enough that they can do that. And supplementation may be required, especially if you live in certain places where you don't get as much access to the sun, or you're in an office building all day and you're going to work and leaving work and it's basically dark. Um, but you also may not want to take that at night. I used to do that all the time because that's when I'd remember to do it. And I was having sleep problems at the time. Some people may
Yeah.
even need to take it twice a day, depending on your genetic report. But you want to take that no later than 2 or 3. For me, it's more like noon because I'm very
Hmm.
sensitive.
Hmm.
And I sleep with a sleep mask because even those little, like you legally have to have smoke detectors and carbon monoxide detectors, which is good.
Yeah.
I want to have those in my home, but the little green lights or the little blue lights, depending on where I am, if they will keep me awake. That's how sensitive to light I am and how much I need it in the morning and don't need it at night. So I just wanted to kind of finish off with a little bit of an extra my 2 cents on the sleep issue.
Yeah, yeah, absolutely. And yeah, for as a general rule, 3 hours before bed works for most people in terms of when to have their last meal, like the kind of latest time. But for some people, like with sleep latency insomnia, where they have trouble falling asleep, let's say they also have good starch metabolism. So for the ME1 gene, like you were saying, I can relate. They could do with like a starchy snack for falling asleep. So they could do with like a small portion of oatmeal, let's say. For other people, if they have trouble sleeping through the night, they might do better with a small protein snack. So these can be like the exception to the 3 hours before bed, no food thing. In that if it's not a meal and it's a small snack, either the starch to help you fall asleep or the protein to help you sleep through the night can be helpful. So it takes a little bit of experimentation, but the genes can help you just know where your weak points are and which might be better for you. So, I was kind of interested in tying in Vanessa Mayroll's question, about how much mood, anxiety, and mental resilience can you genuinely move the needle on, and what's just who you are. Because I do have quite a bit to say on that, if that's okay
Yeah,
with you,
go right
Tracy.
ahead. Go right ahead.
Um, so I think it's important to distinguish between temperament um and how you compensate in day-to-day life. So in the executive function report, like that relates to like brain health and mental health, someone can have um all of the suboptimal versions of different genes, let's say, but they can also not express the negative part of those genes. So let's say, because I have done quite a few genetic reports, sometimes I've seen people who've had like kind of across the board suboptimal, like they've had like bad BDNF production, they've had suboptimal serotonin metabolism, they've had ADRA2B where norepinephrine signaling is heightened, etc. But they haven't had anxiety or depression or significant mental health issues. Then I've also seen the opposite, where people have had like a almost ideal executive function profile, and they've had mental health issues because of early life trauma. So, in terms of temperament, there's actually a lot of association. So, certain personality tendencies towards like neuroticism, let's say, or towards being more outgoing or a better multitasker, or just naturally a more kind of focused person, etc. Um, a lot of personality, I would say, is somewhat innate, but the outcomes are almost entirely modifiable depending on environment based on the genes we're looking at. I don't know if you would agree with that, Dr. Steady.
Yes, and
Yeah.
I think that knowing what other factors can contribute to the body feeling stressed out, right?
Yeah.
So
Hmm.
so if keeping inflammation pretty low,
Hmm.
um, making sure that you're eating right for your body type, not exercising too much, not exercising too little, for you genetically, like all of these things can help regulate the stress system so
Hmm.
that so that's where working with your body instead of against it, because you may have people in your life that are saying, oh well, you just need to do more of this in order to feel better. That's what I did, and it may not be the right thing for you, and you may end up feeling worse. And there are even people who don't respond as well to things like oxytocin. They may not get the same level of comfort from uh, interactions as other people do, right? So
Hmm.
really knowing what are the things that are my go-tos. For some people, it might be that they seek connection when they're feeling stressed out, and having that happen, that they and other for someone else that may not help as much as taking a walk or
Hmm.
something like that, or doing some meditation alone. So there are just so many different ways that people can let their genes guide what needs to happen without feeling like these are my genetics. That means that's just how I am,
Hmm.
right? Because
Yeah.
yes, self-acceptance is wonderful and we encourage that 100%, but not feeling like your genes are your destiny, because there's a lot of free will here. The knowledge is to help give you the free will, not to pigeonhole you into a space of, I am just this kind of person, right?
Hmm.
It can help you to communicate things to other people about
Hmm.
yourself. That it's really helped me to know that I clear stress hormones more slowly, because then I can say, I need to regulate myself before I can continue this conversation. And I
Hmm.
feel empowered to do that. I don't feel like I should be able to just press on with this conversation because someone else can do that. Instead, I can accept that that's how I function and do what needs to be done in order to take care of myself. Because that's the self-care portion of this, and the empowerment is really why we're here to help people. That's what we're here to help people do. Does that make
Yeah.
sense?
Yeah, absolutely. Yeah. And I have seen like just with these functional genomics, they're not genes associated with a specific diagnosis. They're like you described at the beginning, they're genes that affect multiple genes that affect systems, and we try to help you with lifestyle interventions for your particular genotype or stress response. So going back to a similar stress response that I have, having slow comp. There's also like some more sort of mechanistic things we can do. And some of those are included in the report, but also talking with a functional genomics consultant or coach is also helpful. Like for my slow comp, I don't want to have too much green tea because there's some research that EGCG or green tea can slow my comp down further, whereas yerba mate can speed up my comp a little bit. And I've learned that that's like a better beverage choice for me. So there's all kinds of like biochemical supplements and herbs and teas and stuff to play with as well. So it's really helpful to know those. I found it extremely helpful. So yeah. For Nina's question about cortisol changes in that change the charge of the mitochondria, so the main enzyme that removes free radicals, SOD2, cannot enter the mitochondria. Is that why there's so many arrhythmias and cancers lately? I don't know if you have any thoughts on that one, Dr. Steady.
That I cannot speak to whether or not that is true. I have not
Yeah.
looked at SOD2 and those things from through that lens, but it's a very
Mm-hmm.
interesting question. So
Yeah.
thank you for asking it. So we have another question, which
Mm-hmm.
is so, what does using genetic information to manage your anxiety or focus actually look like on a Tuesday morning? Right? Like, how does knowing this change something like anxiety or focus? You know, for some people really have a hard time with focusing and maybe in situations where that's really required, and that can
Mhm.
have a feedback into feeling anxious about going into various situations. So, what are some tools that you utilize in your practice to help people with that?
Yeah, yeah, definitely. So I do see a lot of people with ADHD, and we do have some genes that relate to that. So some people who have fast comped, where you're breaking down your dopamine and your norepinephrine, you might be more likely to have that hyperactive type of presentation. That's not always the case though, because people have different accompanying genes, of course, and combinations of genes. But for that, people recognizing their cognitive type and playing to their strengths can be really useful, as well as different lifestyle or supplements. Things like, for example, those people might do better with green tea to calm them down as opposed to coffee or yerba mate. And then there's also supplements that help dopamine. So I have a double low dopamine, and that one's also associated with ADHD, more of the inattentive type. And again, just because you have that variation doesn't mean you have the presentation, but there could also be kind of that subclinical type presentation. So you may want supplements that kind of boost your dopamine just a little bit, like dopamine bean, for example, or acetylcarnitine, or supplements that lower the anxiety to improve the focus, like L-theanine, or rhodiola. So other than the supplements and stuff, I always encourage people to start with the basics, get out for a walk. But I know you also had some of those kind of behavioral recommendations, Dr. Steady, that were so interesting that relate to the different genetic types.
Well, I think that focus can either be from um, not having enough of something or almost having too much of something and getting overstimulated and overwhelmed, right? And
Yeah.
so depending on which thing it is, and that's something that
Mm-hmm.
people aren't always even aware of, which
Mm-hmm.
whether it's that there's too much going on or that they just have trouble, they just flit around. You know what I mean?
Yeah.
Um,
Yeah.
and so the um if it's overwhelmed by different stimulation, finding ways to kind of um, like noise cancellation headphones
Mm-hmm.
are something that can be
I'm
really
wearing those.
helpful for people who who would get distracted by things and really, but once they get focused, can get really focused,
Mm-hmm.
as well as, stress can really impact things either way in this way, because
Mm-hmm.
sometimes the thought of having to perform in that way and
Mm-hmm.
can stress people out and make
Mm-hmm.
them feel like they have to compare themselves to other people and things like that. So the noise cancellation headphones thing whereas for some people, having music or a familiar TV show helps them focus better. And for some people, silence and blocking everything out helps them to feel better. And so doing the experimentation or knowing your genetic type can help with both of those things. Those are just the first things that popped into my mind, as well as for some people, sitting quietly might be a way to calm things down, whereas for
Mm-hmm.
someone else, movement is a or is a much more soothing way to go about things. So I
Yeah,
would.
yeah, absolutely. So for people who have low dopamine, like getting exercise, especially if it's cardio, but even just a walk, any kind of cardio, can really boost that dopamine earlier in the day. So that's just one lifestyle thing. And then also neural feedback, it is a bit, inconvenient, but if someone's really struggling, and let's say they're not ready to go on medication, or even if they need to go on medication and they're seeing someone for those focus issues or stress, it can really help get you in the zone. Because if you can see the brain waves on top of your genes, then you kind of get like, more information in terms of where you have too much or too little, right? So someone with low dopamine might be like in delta brainwaves all the time or a lot of the time, and they need to get more into low beta, which is like more of a focus zone. And just in case anyone's lost with that, neurofeedback is kind of this technique that a lot of professional sports players use. It's been around since the 70s. They basically hook you up with an EEG, but you can also do it at home. So anyways, that's really effective though. It's like on the list of most effective things for ADHD type symptoms. But um I don't
We
know
have
if
a
we should jump
question.
on. Yeah.
Yeah, we have a question about what kind of neurofeedback have you seen that's effective? And this is someone who is having, oh, there's a second question from her, but I know she's having trouble getting into the Q&A. So I'm
Okay.
trying to look for
Thank you.
her in the
Okay.
in the webinar chat.
Yeah, yeah, yeah.
Uh, there are a bunch of different ones. Neurooptimal is one that I'm familiar with. That's more just balancing things out and is less specific to diagnosing what kind of waves you may have too many or too few of. But
Okay.
what have you found helpful in the past?
Yeah, so for some people with like ADHD who are having trouble getting things done at home, sometimes it does help to go to a local clinic and do like once a week training. That, however, and there's a lot of different companies that do it that way. But sometimes that 1 hour stretch at a local neurofeedback clinic can be the best way to go. Um, However, what I use and often recommend, and I'm not affiliated with a company, is Mind Lift, which is spelled MYND. I can put it in the chat. Mind Lift with a Y. And that one is really convenient because you can do it from home. It still takes a little while to set up. It's not just like plug and play like other apps because you're literally hooking yourself up to an EEG every day or every time you use it. So they just have to look at your brain waves, do an assessment, see what you have too little of, what your goals are, and then kind of create specialized programs to get you in the zone. So that one's really good and it's convenient. You can do it from home. It's a much lower price point, but there's really good evidence that it's effective. And you can even watch videos that you choose, like educational videos or even Netflix shows while you're doing your training. So I recommend that one sometimes to patients depending, but that's a good one for sure. And then other people will just do straight mindfulness, this different kinds of meditation. If you're trying to get from a sympathetic state, like you're in fight or flight, and you're trying to get into a rest and digest, simple diaphragmatic breathing, where you breathe in for 4, hold for a few seconds, and breathe out for 8. And you feel your stomach expand and contract. If you do that for about 5 minutes, or you can go longer, that's often enough. It's surprisingly effective. And sometimes people get sick of just straight meditation. So I find that one's a little bit more efficient. Um, so I don't know if there was any other kind of portion of um, our last question that we didn't cover.
No,
Okay.
so we have one in the Q&A from
Mhm.
Ramona, and then we have then we'll come back to one from Suzanne after that. So let's let's answer this one from Ramona. How
Mhm.
can our results help us discover our optimal environments to live and work in and the types of roles that we might excel in? I feel like I've been misaligned in these areas and would be interested if there are any clues in my genetic profile to implement some changes.
Mhm. Yeah, so optimal environments to live and work in. So I don't know if you have anything off the top of your head. The first thing that comes to mind is vitamin D metabolism, but that's not necessarily a problem. You just might need to take a higher vitamin D supplement if that's affecting you. You might need some light therapy if you're in kind of a darker climate or have heavier winters. I don't know if there's anything that you are thinking of specifically, Dr.
Well,
Stenny.
I think that if some people have certain genes that are affected in their sleep
Mm,
profile, that being someplace that has more light
mm-hmm,
could be helpful, or if, if they would rather have vitamin D from the sun and they can do the conversion well, then
mm-hmm,
that can definitely impact it, but also in terms of detoxification.
mm,
So, if there are certain genes in the GST family, for instance, that you're suboptimal in, how long do you want to live in a city for? For instance, whether
yeah,
you just have more access to things like that, or are there ways that you can mitigate that, right? So it would depend
mm,
on the full picture of what's going on for you. Some people are going to do a better job of clearing things like pesticides than another person might. So they might do worse in a rural area where
yeah,
their neighbor is a farmer who's spraying pesticides all day, right? So it's very that is very specific to the person and their genes. And in
mm-hmm,
terms of types of roles to excel in, that's where some of the stress pieces, which are mood and behavior, if I could speak,
yeah,
uh, report. There are a lot of changes with the new genes that really go into, whether, and it depends if your problem, if one of the issues that you feel like you have is around socialization and managing your stress versus being alone and managing your stress versus many tasks to do versus being kind of bored by doing the same thing over and over again. And so, yes, there are things where the mood and behavior report really can speak to, you might like this type of job more than another job
mm-hmm,
because of what your mood and behavior genes say. And
yeah,
we're not our genes, and there are things that we can do to modify them, but sometimes looking at what feels like we like it and is easy is we can see ourselves in those gene reports.
yeah,
Oh, you're right. That does stress me out. Oh, well, I don't get stressed out easily, but once I'm stressed out, forget about it. You know what I mean? Like
yeah,
I'm out of here. Like people say these different things and trying to figure out what resonates for them, what makes them feel good, what kind of job they might like. The genes can point us in some of those directions, I think.
Yeah, yeah, they definitely can. I mean, if you look at some of the more sort of classic presentations of, let's say, someone who's a little more on the ADHD side of the spectrum, they're really good at sales, they're really good at speaking. They might have, fast comped and low dopamine. I mean, that is a more sort of classic presentation. It doesn't mean that person needs to do that. I've actually come across people who are excellent detail-oriented clinicians that have that type of genetic profile. So it just goes to show how we can modify it. But the things you like to do, the things that are comfortable, your sweet spot when you're in flow, that can often relate to your genetics, your inherent temperament, and your strengths. And then whether or not you're successful with those strengths is all like modifiable. So I think that's what's so cool about this stuff. Is having that extra knowledge just empowers you to optimize and make the most of what you have. And everybody has weaker areas, right? Some people it's their stress profile, other people it's their cardiovascular profile, other people it's their hormone profile. But when we kind of make the most, like I just after looking at a lot of genetic reports, I don't necessarily believe in good genes or bad genes per se, because there's pros and cons to most of these genes. They're not all just good and bad. We refer to them as optimal and suboptimal, but basically there's a lot you could do regardless of your presentation. And knowing your stress profile to answer another person's question can affect your workday and how much social recovery time you need, I would say. I don't know if you're thinking of any specific genes for that one, Dr. Tracy.
Well, I think that it would be looking at a combination of them.
Yeah, of course.
So how quickly that feedback loop happens. Some people actually need to push their system further
Mm-hmm.
into before the feedback loop kicks in. Do you want to
Right.
be around other people for that, or do you want to do some primal screaming on your own? You know what I mean? Like, so
Yeah.
not that it's not okay to be stressed out in front of other people. That's a matter of personal preference, but it's
Mm-hmm.
just an interesting thing when you know, oh, this is what it's going to take for me to get back to my baseline of not feeling stressed out and feeling happy. What are the other genes that are going to impact what that looks like, how quickly it happens, and whether or not socialization is genetically supposed to help, or whether it's maybe not the right answer. People can be left feeling like, but I tried to get support and then I didn't
Mm-hmm.
feel any better. It's like, okay, well,
Mm-hmm.
maybe that wasn't the kind of support that you needed. Maybe you needed a massage instead of to talk to someone. Maybe you
Mm-hmm.
didn't need a massage and you got one, and what you really needed to do was talk, you know? There are all of these different ways that people can go about trying to take care of themselves. So,
Yeah. Or maybe the person has poor methylation and that was affecting some of those cognitive genes because they were neurally inflamed or mentally inflamed. So that's another way that they all kind of interact with each other. So if you know, let's say have a certain genetic combination and you're taking methylated B vitamins, but because you're not methylating efficiently enough, the methyl groups are getting clogged in the system, and then you're getting anxious and agitated. That's just one example of how those different systems interact and how they can affect your stress response. So yeah, I also have poor inflammation, poor methylation, which often leads to inflammation, which leads to stress. So someone wants to know how old we are. Older than we look, I would say. I'm 39. I'm comfortable telling people my age,
I
but
I turned 50 in January. But I
you
I
look
have
great for your
millennials.
age. I thought you were at least a decade younger. That's
Well,
impressive.
thank you. I
Yeah.
have millennial siblings, so that's why I was like, we need more millennials in our in our
Yeah.
ecosystem. It'll be awesome. Um, but that's a funny question. I'd actually like you to put in the chat why you wondered how old we are. Did you think we're too
Yeah,
old to be millennials, or you were just wondering how much experience we have with
I'm
any of these?
guessing maybe our credibility, like if we look younger than we are, but we've been doing this for a while, maybe that adds to the credibility. I don't know. That's just a shot in the dark guess.
And
But
this is how
yes,
you can
Eric,
tell that
we are
I'm
curious.
That's how you can tell that I'm Gen X because I was going to make a Doogie Howser comment, and that would have dated me, for sure. So we
Thank
have
you,
a
Tracy.
question.
She said we look great. Well, thank
Oh, thank you.
you.
Um, we have a question about, is there a better time of the month or cycle to have hormone tests done, both urine and blood tests? And for urine, I think that it's usually recommended that they're done about 9 days before your period or about day 20, 21, depending on I've seen it written both ways. And in terms of blood tests, that's day 20, 21 is a great time to do it, but there are other tests that are really helpful to do in the beginning of the cycle, depending on your age. So I can't give you a 100% answer on that. But if you're looking for progesterone specifically, you're going to want to have that be at the peak time. Now, that said, depending on how old you are, that could be a little wonky. If your cycles aren't regular, then the days of the month don't necessarily mean that much. So that's where Mira is really helpful because you're tracking it over time, as opposed to Dutch, which is fine if you either have regular cycles or if you're postmenopausal and things are more consistent. Um, Second part of the question, do some people have genes that may slow down the clearance of inflammatory types of estrogen, but on these tests, it shows that the woman is clearing them well? Yes, and that means you're doing something right. That's the goal, is to have if you have the genes that show that you have a tendency to clear down the 4-OH or 16-OH pathway, and 2-OH is preferable, and that's what you're doing. Good job. Like you're eating well, you're exercising well, you're drinking, you're pooping, you're doing all of the things that are necessary. And then oh, so sorry, I lost where I was in the
Yeah,
bifocals.
no, that was a really great summary,
Um,
Dr. Steady. Yeah, it is ideal if you figure out what your genetic predisposition is hormonally, but then you also get that live feedback. So the Dutch will tell you some of those hormone metabolites, which are useful, what you're excreting. And then if you are doing bioidenticals, getting a serum blood reading on days 3 to 5 and day 21 for progesterone is ideal. So anyways, you just covered that though. So
um,
circling back.
So we got answers from
Yeah.
Eric. He wanted
Yeah.
to see how well all of our advice worked. Um, so and he thinks we're
Well,
doing just fine. So
he
thank
thinks
you.
our
Thank you for
advice is working. Okay, appreciate it. Appreciate it. Appreciate the clarification there.
We have a
Um,
question which is, is it appropriate for millennials to do a DNA aging test or just the DNA 360? So, as some of you may know and some of you may not know, we have a test called the de-aging test, which uses biomarkers to show how different organs are aging. And then you can do it once and then do it again in 6 months or a year and see how well the interventions that you're doing are actually affecting your biological age. Your age will remain the same on your driver's license. There's nothing that we can do about that. But the kind of advice that Dr. Sapp and I are giving, which Eric was wondering how well our advice works, that's exactly what this test is designed to do. And so for someone who's younger, if your test shows that you're aging faster than you want to be, the earlier you intervene and start working with your body genetically instead of ignoring what it might want, the better off you will be. So the short answer, which I'm seemingly incapable of giving, is yes. The
yeah,
DNA aging test is completely appropriate for someone who's a millennial.
definitely. Yeah. Yeah. I mean, as of your mid-20s even, you could start doing those tests theoretically, right? I mean,
Yeah.
yeah, I would say 30s and 40s, absolutely. And then the next question was what was our biological ages? I
So I'm
don't
waiting
have
for my
one.
results. I've done it a couple of times, but I just did one not too long ago and I'm waiting for the results. So you'll have to tune in the next time I'm on a webinar to get that answer because I don't
Did
have it right now.
ditto. I don't have one.
The
Yeah.
last two that I did, my biological aging did go down
Nice.
because I was able to see what was going on and look at my genes and see what I needed to do differently and do those interventions. And my age did go down. So, and I anticipate that being true again with this last test that I did.
That's
So,
awesome. And it's from True Age, correct? Or through, you're doing the Deneen paste with like some specific
uh, it's
recommendations with that one, right?
yeah, it's our DNA, it's our DNA aging test,
DNA aging, sorry.
which is
Yeah.
on our website. So,
Yeah. And you
yep,
guys have really good, like specific recommendations for slowing
yes.
the pace of aging when you get the results. So how long do you recommend waiting between doing those tests?
Yeah, so I think I waited 6 months. I think doing them you don't want to do them too soon. And also, some kinds of biological aging tests are more susceptible to something that's going on within the last week.
Mm-hmm.
Whereas the one that we're doing that we have is really a better marker of a little bit longer of a chunk of time because
Okay.
you don't necessarily want to take a test not knowing you're fighting off an illness because you know how sometimes it can
Yeah.
be kind of brewing before you feel sick and have
Yeah.
that just end up with some wacky
Effect.
result. So that's one of the things that I really like about our test is that it's more reflective of interventions over time. So which
Yeah.
is great.
Yeah,
Um,
that's really important. Um, so we also have some questions in the webinar chat
okay.
about serum progesterone. If going to try bioidentical hormones if you're 50, do you still need to test for serum progesterone? So there's a lot of conventional doctors, like MDs, won't test it and they'll kind of go by symptoms and age. I personally always test it because there's a couple different doses available as well. And like I said, some people can do well with a booster of like a natural supplement cream or supplements to boost progesterone, estrogen, testosterone, and other people you want to go straight to the bioidentical. So I like to get a read on it first and then even a second read because especially in perimenopausal, menopausal years, they can fluctuate pretty drastically sometimes. So I personally always test it, but that's not necessarily the standard of care across the US. So, yeah.
And making sure that that ratio of estradiol to progesterone is good is another
Mm-hmm.
reason why testing progesterone can be important because over
Mm-hmm.
50 can mean something different in different people because some
Yeah.
people are still having cycles regularly. So
Yeah.
there's not an age cutoff at which I would say, well, I mean, there might be some age cutoff, but I would not say just blanket over 50, you don't need to do that. And especially if you are going to be doing supplemental bioidentical estrogen, you want to then be monitoring both of those hormones to make sure that they stay in a good ratio. Specifically if you still have a uterus.
Yeah.
Because if the ratio is off and you still have a uterus, the progesterone needs to be able to be balanced out with the estrogen for safety reasons. So,
Yeah. Yeah, that's very true. Yeah, so different approaches there, but I personally like looking at the markers. So is there anything else here, Tracy, that I think we should cover?
I guess one thing that people wonder a lot about, I think,
Mm-hmm.
is familial tendencies, right?
Mm-hmm.
So we're talking about genetics, and they're wondering if everybody in my family had this problem after this age, Does that mean
Hmm.
that's my destiny? Right?
Yeah.
And so one of the things that I just always like to tell people is no.
Yeah.
You don't, your genes are not your destiny and your family isn't your destiny. Not only because you have, even if both sides are a little rough, which happens sometimes where you're looking and going, I don't want either one of those paths really. That I mean, this is what people say to us a lot because they're one of the reasons that they want to do the testing is because they want to avoid the health problems that they've seen in their families. And they also wonder why it can be different. Like there's this one random person who's happy and the rest of the family struggles with depression, or vice versa. Like
Yeah.
how did this one person end up with depression? Was that genetic? Should like they get blamed because nobody else in their family is like that, but there still could be a genetic component in that it could be about inflammation or
Hmm.
metabolism or detoxification.
Yeah.
So all of those things are still possible. So I think um, you can do things differently from your family. And if you find that
Definitely.
you are different from your family, what are you doing differently, or what are you exposed to that they haven't been,
Hmm.
or are they just kind of not telling you what's up, right? Like 'cause sometimes some of the
Yeah.
older generations aren't as open about things as the younger generations, and so you might not know what they struggled with. I've had patients who were like, I didn't know until I was doing these interviews for a breast cancer documentary about younger women and breast cancer.
Mhm.
Because statistically, more younger women are getting diagnosed than they used to. And so
Yeah.
I wanted to explore that a little bit. And one of them said, and it's fine that I'm sharing this because she said I could share it in the documentary, that I think 5 women in her family had all been diagnosed with breast cancer, but nobody had told her. She said, I would
Wow.
have started getting screened way younger than I did, but I didn't even know that that was a thing. And
That's
while our
wild.
testing doesn't screen for things for BRCA or, things like that,
Yeah.
just knowing what's going on with you on on this blueprint level of what you came in with, that what you inherited from both parents, and then being able to work with yourself and not against yourself. I think I sound like a broken record, but I think that's really a good thing to do. And you
Yeah.
can be the cycle breaker because not your parents and grandparents didn't necessarily know, oh, they shouldn't have been eating only pasta because they can't break down starch very well and it spikes their blood sugar, and they ended up with this whole thing, and you're like, oh, I'm gonna throw some veggies in the mix. Let's see what happens, right?
Yeah.
Like, so it can be very simple little things can really make a huge difference when you're talking about um, trying to move the needle on these modifiable genetic predispositions. So
Yeah, that's a really good point for sure. For most of these genes, your genes are not your destiny, pretty much across the board in this report. A really good example of one that people are often really worried about is ApoE. So the Alzheimer's gene. Do I have the Alzheimer's gene? So there's a bunch of genes that can, predispose you to dementia and Alzheimer's. For most people, the variations like of ApoE are modifiable. The earlier you see what your variations are, kind of the better. But pretty much across the board, they're modifiable, with APO44 being the least modifiable if you catch it late. But really, it's empowering because if you have like a worse variation, it just means you have to work a little bit harder on the preventative factors. So they can pretty much save you. If you have really bad methylation, you might need to work more on anti-inflammatory protocols. You might need to take the right B vitamins and not other B vitamins. And that can drastically change outcomes for a lot of things, including mental health conditions. So, um, yeah, most,
yeah, there are some of our new genes. Sorry, I didn't mean to cut you off.
yeah, no, go for it.
Some of the new genes in the mood and behavior report where um, exercise can completely negate the genetic tendency.
Hmm.
Like, how awesome is that? Like, you have a genetic tendency toward not responding well after trauma.
Mm-hmm.
or having your HPA acts, your stress response be stronger and not clear as quickly as someone else's. And all you have to do is go out and take a walk, right? That's like it's free.
Yeah.
And you just do that regularly and it can change how you feel about life, right? So
Yeah.
these are these you know, and the ApoE is one that we test for, and that's it. But the reason that we do that is because it's not destiny. So we're
Mm-hmm.
not testing for anything that says you will have this happen for
Mm-hmm.
sure. It's just
Mm-hmm.
like you have an increased risk of this, and here are the things that you can do to make
Yeah.
that less likely to happen. And there are real things and we use science to figure it out. And not just like one study of one person, but looking at lots of different people and then working with people ourselves and seeing those results. And how inspiring is that, Dr. Sapp, to be able
Yeah.
to see people feeling better and feeling more hopeful about what their future holds.
Yeah, absolutely. Yeah. And dementia and Alzheimer's is just one example where I just love to help dispel that fear, you know? So many people have this background fear, like I will or will not get dementia. And it's like if we understand like most of this is environmental. Let's see how much environmental changes you need to make. And no, it's not your destiny. Let's kind of do something about it. Um, that's great. Just it's very empowering. And I think that's what this is really all about is like taking back the power to change our health, knowing that we can change outcomes, because that's really what these reports are about, is changing outcomes over time, you know, and knowing yourself, basically.
Yeah,
So,
100%.
yeah,
100%.
yeah,
Well, Dr. Sapp, thank you. It has been a delight and pleasure, as always, to be on this webinar with you. I love chatting with you, and thank you to all of our participants and to those of you who asked questions, and to those of you who wanted to sit tight and not ask any questions. We're here for you and to help. And thank you very much for hanging out with us this evening or this
yeah.
afternoon, depending on where you are.
And thank you so much, Dr. Steady. Thank you to our audience, and our hosts over here and our tech support as well. It's been an absolute pleasure. I love talking about these things. We could talk about this all night if we let ourselves, right? But appreciate the engagement as well. And hopefully we've given you just a bit of feedback on how functional genomics can help and a few takeaways for stress management and some of the foundations of health. So we can all aim more towards optimizing it. All
And
right.
there is 10% off code, and you don't have to be a millennial to use the millennial code. You just needed to come to this webinar and get the code. So no one's going to card you and say you're not a millennial, you don't get to use that code. So that has just been put in the chat. We encourage you to get your testing done, and as always, we're here to help you if you need any help with where to go from there once you did get tested. So thank you all
Yeah.
so much, and have a wonderful evening.
You.